We are just playing around with a new concept here. So we're looking at trying to do a show that we could live stream and where my guests are actually you guys, and we could bring you on and you can ask a question and we could have conversations and debate like you would in a comment section, but instead being live. So let's see if we can try out a question. Would you recommend taking an omega-3 if you're doing a plant-based diet? And I 100% would. There's been really mixed results out there right now, but if you look at the EPIC data, which is a study of what was essentially plant-based people versus meat eaters in England, they looked at specifically in Oxford. And the interesting thing about those vegans there is they were mainly ethical vegans. They weren't really trying to be healthy. They did not take supplements. They didn't eat fish, and they had pretty low omega-3 levels and actually low fiber levels. And they did well, but they didn't do as well as when you look at the pesco-vegetarians in the Adventist Health Study and even the vegans in the Adventist Health Study. And there is a consideration that omega-3 may be essential both to heart health and possibly brain health. I don't think there's much of a downside to using it, except that polyunsaturated fatty acids can go bad really quickly, so you need to store them in a dark place that's not too warm. But other than that, we really haven't seen problems with that. So I definitely would use an omega-3, and I do every day. I use Ovega. I don't get paid by any brands. That's just what I use. Everybody asks me. Nordic Naturals has a brand. Some of the other ones have a brand. So I got a question here. You read my book and found it interesting. Are you writing more books? I started writing another book. Right now I'm not writing it. It's more about obesity and about how people that are successful losing weight, what do they do? What is the key things that they do in order to lose weight? I'm trying to get more into the mindset of it, but that won't be out for a while because a little bit too busy right now. Top 3 foods everybody should have and how often. Everyone should have some kind of grain. So I try to get oats every day, or I really try to work on getting whole grain breads. I use Ezekiel bread. It can be rice, it can be something like that, but grains are very important. If I do rice, I use long cut basmati rice. It's basically the least processed. You don't want polished rice. The only thing with rice is it can be a little bit more contaminated with things like arsenic, so you got to be a little bit careful about what you choose. But I do get organic basmati long grain uncut rice. The other thing I think everybody should get is legumes. So I try to get beans multiple times in a day. I think beans are extremely important. And the other thing is dark green vegetables, some kind of kale or collards or spinach during the course of the day. Constipated on a whole food plant-based high fiber diet with plenty of fluids and exercise. That is very rare, but it can happen. There are a few things to think of. Number one would be to take Metamucil prior to your actual meal. Number 2 is to gel chia seeds. So actually let them sit in water and get a gel and then add that to the foods. Third thing are prunes and prune juice. I see it says here that the person already takes Miralax. Miralax is basically an osmotic. So what it does is it kind of creates like a tidal wave of water going through your system, and it's fine to take that, but I find that doing the Metamucil before the meals works a little bit better, as does the chia seeds. If you're still having problems, then I would really go and see a gastroenterologist, because you may want to look at trying some of the medications like Amitiza and Linzess that actually cause the wall of the muscle of the colon to squeeze. And that may be, you might have a problem with that. There are some people that are looking into this being a SIBO effect or possibly a dysbiosis. And so there may be a role in trying to change your microbiome. And so there's different ways of doing that. With SIBO, I treat people with something called Xifaxan, which is an antibiotic that basically stays in the system. It doesn't get absorbed, and it wipes out everything in your small bowel. And I kind of combine that with neomycin, which is another antibiotic. And then I replace with people doing probiotics, and I use a probiotic called VSL3, which lately it's hard to come by, but then also using fermented foods. That replaces your bowel bacteria. That may change the function of your bowel. But all of these things need to be done with a really good gastroenterologist. Fluid retention on a low sodium diet. Fluid retention on a low sodium diet should be fairly rare. You got to make sure that you're balanced as far as your all of your electrolytes. So not just focusing on sodium, but what is your magnesium intake? Are you getting enough zinc? Are you getting enough potassium? A lot of times when people are getting these fluid retention problems, they're out of balance altogether, and it's not just the sodium at large that's playing an issue. And then the other thing is weight. So a lot of what people consider sodium retention and fluid retention actually has more to do with the physical excess weight in the abdomen, which can place pressure on the drainage from the legs, and so the legs tend to swell, and people say it's the salt intake, but it's not really the salt intake, it's weight in general. Exercise obviously is a huge help in that situation. What do I think of other doctors like Dr. Avi debunking the heart reversal on a whole food plant-based diet? Dr. Avi, Danielle Belardo, a lot of people that are bringing this up are not wrong. What they are trying to do in this situation is basically, there's a lot of, and I see this a lot, people have taken the idea of a whole food plant-based diet, a vegan diet, and they've kind of put mythical qualities to it, where they now think it cures everything and they don't need to go to a doctor anymore. And that could be a serious problem. A whole food plant-based diet is very good at preventing heart disease. It can help with heart disease. But when you look at Dr. Esselstyn's and Dr. Ornish's data on reversing heart disease, it is a very slight reversal. And if I had someone with really bad heart disease, I would not only put them in a whole food plant-based diet. I would still use medications and Western therapeutics. We've had a drop in cardiac mortality over the years as we've become more advanced with our medications and our treatments. And what Dr. Britt and Dr. Belardo and some of these other doctors that are doing that are vegan themselves and believe in a vegan diet, what they want is for people to understand that a vegan diet is important, but avoiding medication altogether is not a good idea, and you need to use the two together. What do you have to make of the soul? Oh, wow. What do I make of the soul? That's an interesting comment, and one I think about a lot. The soul. Obviously, in medicine, we don't learn much about the soul, but every single doctor has had weird experiences with patients. Like if I've got a sick patient and they tell me about a dead relative that is visiting them, I get worried because almost invariably they are going to pass, and they seem to know before I do. I believe in a soul, but there's no way of testing and knowing for sure. But maybe that's a topic we'll bring up one day and bring on someone so that we can talk about it. What precautions do you recommend on frequent blood donors? Plant-based eaters are not at a higher risk of anemia. So this has been studied before, but we do tend to have lower iron levels. Though I think you can donate blood. They're going to check your blood counts and see how you're doing. I think so long as you're concentrating on getting high iron foods such as legumes, like we talked about, lentils, grains, wheat germ, things like that, you're going to be fine, and it's not going to really be a worry. There may be a therapeutic benefit to having low iron. Believe it or not, if you're diabetic, donating blood is a really good idea because iron actually interferes with the cells that secrete insulin, and so dropping that is actually fairly important. So doing blood donations regularly is, I think, a good idea. Hair loss and seborrheic dermatitis on a whole food plant-based diet. So that's odd. Usually a whole food plant-based diet actually helps with seborrheic dermatitis. Hair loss, so hair loss is a weird thing. There are so many different things that cause hair loss, and you will see hair loss in just about every diet. If you lose weight rapidly, we see it in our weight loss surgery patients all the time, that rapid weight loss causes hair loss. And when you look at that, there's many different causes and stresses. We know that stress causes it. We know low protein does it, but I think you could get adequate protein in a whole food plant-based diet. Lack of iron will do it. Lack of zinc will do it. But if you're eating a really good whole food plant-based diet, getting supplements when you need to, that shouldn't be too much of an issue. Obviously, as we age, there is some hair loss, and obviously there are other issues, hormonal issues and things like that. For men that are getting male pattern baldness, you do have to look at this testosterone levels and a testosterone called DHT, and it happens in women too, especially women that are struggling with their weight because the fat may interfere with the breakdown of estrogen and change it to testosterone or a specific chemical called DHT. It's actually DHT. DHT is actually what affects the hair follicles, which is why certain drugs that men could take that actually block DHT, the same kind of meds they take for a large prostate, can help, though those have side effects. There are some weird hair therapies now, such as using red light therapy on your head or using a shampoo like ketoconazole, because ketoconazole does block DHT. And if you're really getting fancy and don't mind spending money, they could take your blood out, spin it, take the serum and inject it into your head. And that actually does cause some hair cell growth. Difference in muscle growth by hitting total protein leucine, yeah. So we're talking about muscle growth and total protein. And this is an interesting topic. There are a lot of exercise scientists that have really been trying to study what exact amount of protein we need to maximize muscle growth. And they found a few things. They found in trained athletes that are in a cut. In other words, they bulk up and then they want to cut down so that they could go on stage lean, but they want to preserve their muscle. They found that there is a difference if you could increase your level of protein by percentage. So in other words, if you're typically getting 20% of your calories for protein, if you could bring that up to 30% while cutting, that helps maintain muscle mass. The other thing that we find works fairly well is in the question that the person asked about leucine is getting branched chain amino acids, because leucine specifically stimulates a hormone called IGF-1. And so what is the maximum total protein that you need in order to get enough IGF-1 stimulation and mTOR stimulation to maximize muscle growth? And right now, it looks like that's somewhere between 1.2 grams per kilogram of protein, and that kilogram is lean body mass, and 1.2 to 1.6. Now, what if you're plant-based and using plant-based proteins? I don't think there's a difference. I think there's a lot of people saying that it's not as much bioavailability, but it turns out that it looks like you're going to maximize your muscles on 1.2 to 1.6, whether it's meat or whether it's plant protein, especially if you're using soy. Now, here's the issue. Why are we going to such lengths to stimulate IGF-1? Because while IGF-1 will stimulate muscle growth, it will also stimulate cancer growth. And while mTOR will stimulate muscle growth, it does seem to stimulate some of the aging pathways. And a lot of the aging researchers are looking at ways to block IGF-1 and to block mTOR. And so this obsession we have with maximizing the muscle we build may really get into a problem in the future. And it may actually be better if instead of trying to maximize our muscle, we get enough muscle. Maybe not the maximum amount, enough. So I tend to supplement with protein or try to increase my protein around the time that I actually do a stimulus to my muscle. So I just got done working out, and after my workout, I ate a big bowl that had tempeh and black beans and brown rice. And so I got a lot of protein in that because I wanted to stimulate my IGF-1 and my mTOR right after my workout. But my meal tonight's not going to have a lot of protein in it, and my breakfast doesn't have a lot of protein in it because I don't want to constantly stimulate my IGF-1 and mTOR. And in this way, I'm very different than the exercise physiologists. They're telling people, we want you to get 1.2 to 1.6 grams of protein. That's a lot of protein per kilogram. And so you're going to have to eat it all during the day. So all during the day, you're stimulating your IGF-1 and mTOR. And I think that may really play a problem in longevity in the future. All right, so Rebecca's asking, what are your thoughts on the starch solution, 50% of the plate being starchy vegetables, and is it good for a ruined white patient? Eating a lot of starches, I actually think is pretty good. If you look at the, so there's a lot of things with starches that people don't seem to understand. There's a thought that carbs make you fat and starches are carbs, and that is completely not correct. If you look at overfeeding studies where they actually gave people a huge amount of carbohydrates, very little bit of that gets turned into fat. Your body utilizes those carbohydrates, or we actually have storage in our bodies called glycogen that can store your carbohydrates without creating fat. Turning carbs to fat is called de novo lipogenesis. It's very difficult for the body to do. It tends not to want to do that, and when it does do that, it requires energy to do that. And if you look around the world at some of the healthiest, thinnest populations, they eat a huge amount of starch. The Okinawans eat a lot of sweet potato, and they eat a lot of rice, and you're not seeing in them any kind of fat storage. With a lot of these starches, they come with other really good things. I mean, with grains, with potatoes, you're going to get a lot of other nutrients that you definitely need to get in your body. Oats have beta-glucan and things like that. And then if you take something like, if you make a pasta and then you refrigerate it and then you recook it, you get what's called resistant starch. So you actually cross-link these glucose molecules, and that gets into the colon and actually feeds your microbiome, so it gives you a more healthy microbiome. Those actually, you could turn your starch into a prebiotic. So I think it's a good idea. Is it a good idea for Roux-en-Y patients? Definitely. I have my Roux-en-Y patients definitely focusing on complex starches. I have a dumb hypothesis in which protein powders may be similar to a lot of sugars at one time and stretch protein intake over hours. Yeah, that probably isn't exactly true. I mean, protein can get turned into sugar through gluconeogenesis, but it's fairly small amount, so I don't think that's going to be too much. But I don't use much protein powder, to be honest. I do occasionally, after a hard workout, sometimes you just don't feel like eating, and then I'll do a shake just to get that quick IGF-1. Now, the other thing about taking protein after a workout is it really needs to be combined with carbs. Your body is not going to get that good muscle protein synthesis unless that protein is combined with carbohydrates. A lot of the science argues back and forth, but it tends to be a 4-to-1 ratio of carbs to protein in order to really get a benefit. I'm surprised that the mass media hasn't acknowledged the benefits of plant-based diet and COVID and future pandemics. Yeah, they really should. I mean, a lot of people are complaining that, we're talking about masks, distancing, but we're not talking about actually being healthy. And we know, if you look at the data coming out, that being overweight and being sick gives worse outcomes with COVID. And so we should be talking about that, frankly, but we should be talking about that with everything, because being overweight and being sick gives you more diabetes, and it gives you more obesity and more heart disease, so it should be something that we need to be focusing on more in general. We don't, if you got COVID tomorrow, or, if you're overweight and you're going to try to get healthy, you're not going to get healthy overnight. So you still got to use a mask. One salad is not going to protect you from COVID. So, the media is not going to focus on that right now. They're going to focus on, and our, decision makers like Fauci are going to decide on, what's going to protect us at this moment right now. But I would like to hear a little bit more from media in general, as I have for all my years of being a doctor. I'd like to hear more from the medical profession about lifestyle. All right, guys. Well, thank you so much for playing around with us. I'm going to do more of these in the future. We'll do Q&A. We'll try and get some live Q&A and some discussions. Maybe have some guests where we can involve some people talking with them. But thank you very much. I hope this worked well for you. Thanks.